organizations that study the safety of medications in pregnancy, the American College of OBGYNs, the Society for Maternal-Fetal Medicine, have reviewed the evidence and the studies behind low-dose aspirin in pregnancy and have concluded that it's safe and should be used in patients that are at higher risk for developing preeclampsia. So in your situation, your obstetric provider, whether it be your OBGYN or your midwife, has looked at your risk factors and determined that you are an increased risk for developing preeclampsia. And there's a long list of reasons that might be. You may have a history of high blood pressure or diabetes. You may be carrying twins or triplets. This may be your first baby. You may have an increased risk based on your age, your obesity. Preeclampsia is a pregnancy complication that can be dangerous to both mom and baby, and it's important we do everything we can to reduce your risk of developing that. The aspirin, it's important to know, does not actually treat blood pressure. It's not going to reduce your blood pressure. You may need different medications for that. While aspirin is typically recommended as best to start between 12 and 16 weeks, you can start it actually all the way up to 28 weeks and still have some benefit to the baby and reducing your risk for preeclampsia. It does not increase the risk of bleeding for mom or baby. It will not affect your labor. You don't have to stop low-dose aspirin before your delivery date. You can take it safely and still get an epidural for labor or a spinal for a C-section.